Hi guys, my name's Dan, I'm a veterinarian, and today, pancreatitis in the dog. The pancreas lives naturally right beside the stomach and it kind of just rolls down against the small intestines, or the duodenum. The pancreas has two major jobs. Number one, it secretes enzymes to help digest food for the doggy. And number two, very important, it produces insulin, a hormone, into the body to help regulate a dog's blood glucose. Both of these jobs are super important. So if the pancreas isn't happy, we have a very unhappy doggy. When a doggy has pancreatitis, the most common thing you or the pet owner is going to notice are a couple things that are very consistent. You almost always have vomiting. Vomiting because there's so much nausea from the inflammation of the pancreas, because it sits right there next to the stomach and the small intestines. Many dogs also have diarrhea, they're lethargic, they don't want to eat or drink, and a lot of them have abdominal pain. So they may even do a praying stance, where their paws go down and their butt goes up, because it hurts so much and they're trying to get comfortable. We're not exactly sure why most dogs get pancreatitis. So a lot of times I can't even tell the pet owner why we have it. Like, Dan, why do you have pancreatitis? I don't know, but we have it. Other times, pancreatitis can be caused by a high-fatty meal or an unhealthy meal that may help drive the pancreatitis or the inflammation. Pancreatitis is so serious because when the pancreas gets inflamed, these enzymes that should be digesting food in the intestine, when the pancreas gets inflamed, starts digesting the pancreas. Now, you can have very mild cases and more severe cases of pancreatitis. The really mild cases, there's some inflammation and maybe some autodigestion of the enzymes, but we don't have generalized breakdown and damage and inflammation of the pancreas itself, like the more severe cases. Pancreatitis is one of those diseases where you need to go in and see your veterinarian because this can be life-threatening. This can be really serious. Now, most cases are resolved and cared for quite beautifully at the veterinary hospital over about, 2 to 4 days of IV fluids and supportive care. The major thing is we want to support the doggy to help out with hydration, so IV fluids. We want to give pain meds if we're really painful. We also will give different tummy meds or nausea meds to help stop the vomiting. If we feel like there's an infection, we may do an antibiotic as well. And depending on how severe the case is, there may be other meds we may implement as well to help the doggy recover. In most cases, a doggy can recover completely from pancreatitis and live a very happy, healthy, normal life. Most veterinarians will put a doggy that's had pancreatitis on some kind of low-fat diet, low-fat food, which may help prevent pancreatitis in the future, because we do believe if a dog had pancreatitis once, they may be more likely to have it in the future. Pancreatitis can be diagnosed a handful of different ways, guys. The CPL is the most common way to diagnose it, and this is the canine pancreatic lipase test. Now, this test is a yes or no test, and the thing is, if a dog is really sick, we don't just want to do that, because it's not perfect. It's great, but it's not perfect. So doing other lab work to assess the other organs to make sure they're healthy and stable, maybe doing an X-ray and ultrasound to visualize the pancreas as well can be very beneficial. Doing that CPL is great, and we should do that, but having supportive lab work and other diagnostics or images could help support our diagnosis and also give us an idea of how serious things are. I've had some pancreatitis cases where they're diabetic as well because the pancreas is so beat up and the insulin is no longer being produced. In that case, we have a diabetic and a pancreatitis case. And if I just did the CPL test, I would miss the other major diagnosis, the diabetes. If this content regarding pancreatitis has been helpful for you guys, please like and subscribe. If you've had experience with your own pancreatitis case, with your own doggy, please let me know about that and how it went.